We begin the evening with a delightful discussion of a donation and I believe a bit of show and tell here. Our friends from Adventist La Grange Memorial Hospital, Chief Executive Rick Wright and Ted Carlberg, of Regional Executive Adventist Cardiovascular Network, are here to present an automated external defibrillator. Okay. You know what, I'm going to have you say it. Defibrillator.
We just say AED.
Thank you. We're going to get an AED, which they're presenting to the Village of La Grange for installation at the La Grange Road train station. Obviously a location that is utilized by lots of people on a daily basis, our citizens and visitors to La Grange alike. The donation is made possible through the partnership between Adventist Health Systems Cardiology Program and St. Jude Medical.
Chicagoland, we've got 4 hospitals in Bolingbrook, Glendale Heights, Hinsdale, and La Grange. And I'm going to put in one plug and then we'll get to the real order of business. Of the 4, La Grange right now is the strongest and the most vibrant of those 4 hospitals. We've put together a real string of successes, and that is due in large part to the support that we feel from this community. Much of the volume we get in our hospital comes through our ER. And as a result of that, we're very dependent on that good working relationship. And I want to publicly thank the village and EMS and others that do support us. And so it's our privilege and our pleasure to make this donation tonight, just again as part of our commitment to the community.
October is National Sudden Cardiac Arrest Awareness Month. I know you all have that in your calendars, but the reality is that 150,000 people in this country will drop dead of a heart problem without any symptoms. And we're finding out more and more through the research that we've done that this is not due to blockages in vessels, as most of us have been accustomed to learn over the years, but it's in arrhythmias, irregular heartbeats that cause these situations. So to have this kind of technology available is an absolute first step in recognizing that we really need to educate our public about the resources available to ameliorate these sorts of situations. Our governor just back in February, Mr. Quinn, was quoted in the local papers as saying no public place should be without an AED. If you've gone through O'Hare or any of the other airports or public places, they're everywhere. And we're going to ask Mark Hermes from Cardiac Sciences, the manufacturer of the device, to set up a very brief demonstration.
Very happy to be here on behalf of Adventist. It's a very generous program that's been donating AEDs to the community. Ted mentioned sudden cardiac death, the #1 cause of death in the U.S. In places, public places, airports, schools that have AED programs, what we've seen is the survival rate from sudden cardiac arrest for somebody who goes into a full-blown arrest, the typical national survival average 5%. In those places that have AED programs, the survival rate's at 50% and higher. And the devices are very simple, user-friendly. You simply open the lid, and the device talks you through the rescue. You can listen to the voice, you can listen to the text prompts. Listen to the voice prompts.
Follow these voice instructions. Make sure 911 is called now. Begin by exposing patient's bare chest and torso. Remove or cut clothing if needed. When patient's chest and torso are exposed, remove square foil package from lid of AED. Tear open foil package across dotted line and remove pads. Next, separate one of the white pads completely from blue plastic liner. Begin peeling from the tabbed corner. Firmly place the pad without the liner on the patient exactly as illustrated. This pad can be placed on either of the 2 locations shown. Next, peel the blue plastic liner off of the second white pad. Firmly place the second pad on the opposite location. Make sure pad connector is plugged into AED. Make sure pad connector is plugged into AED. Do not touch patient. Analyzing heart rhythm. Please wait. Do not touch patient. Analyzing heart rhythm. Please wait. Do not touch. Preparing shock. Move away from the patient. Shock will be delivered in 3, 2, 1. Shock delivered. It is now safe to touch the patient. When instructed, give patient 30 rapid compressions. Then give 2 breaths. Place heel of one hand on center of chest between nipples. Place heel of other hand directly on top of first hand. Lean over patient with elbow straight. Press the patient's chest down rapidly, 1/3 depth of chest, then release. Start CPR. Press, 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 press.
And that's it.
Well, I think you can see that the technology is incredible and it's so user-friendly, and 96% of the times that this is implemented is not with trained professionals. Well, Mark and people in the hospital recommend training. This is something that anybody can do, and you can see that it walks the user through the process very simply, very slowly, and very clearly. So we are very happy to be able to do this for the Village of La Grange, and thank you very much for this opportunity.